Guest in studio. Well, she's actually not in studio. She's at her office, but we're going to be talking about the COVID-19 vaccine. There's a lot of questions that I have. I know there's a lot of questions that you have. Feel free to ask those and share this out. Here we go. Good morning. This is KHEA Radio 99.5 FM. I have a guest on air today that we're going to be discussing the COVID-19 vaccine with. I'm going to let you introduce yourself and then share the organization you're with. Good morning.
Good morning, Gardy. It's so good to be here again. Thank you for letting me come back. I appreciate it. You know, we met earlier this summer, I suppose, when we began COVID-19, this pandemic that we've been in for quite a while now. Didn't expect to be in it this long, but you know what? Relief is coming. We are beginning to see the vaccinations, the COVID-19 vaccinations that are being released. And, you know, we're just thankful here at Community Health Network that we should be anticipating these vaccines coming up in the next couple of days. I'm the Chief Medical Officer here at Community Health Network. We have been going strong since the pandemic began. And we have just been out there in the community screening, testing. We're even taking testing to persons for COVID-19. We're just trying to make sure that we can get our communities back up and running and eventually get us back to some normalcy. Right now, you know what, Artie, we have screened over 40,000 persons.
Wow.
And we've done about 11,000, a little bit over 11,000 tests for COVID-19. Unfortunately, the positivity rate, we see what's going on in the world, how many cases here in the United States, and also the death toll, which, you know, my heart goes out to families, to my friends, to the community who have lost persons. But, you know, in a nutshell, that's who we are. We're here for the community.
All right, Dr. Poindexter, the first question I have is how many vaccines are there that are allowed to be used? I've seen the Pfizer one, but is that the only one that's been approved and going to be rolled out?
Well, let's use the word emergency authorized, because at this time, the FDA has approved the emergency authorization of two vaccines. There's a Pfizer vaccine and the Moderna vaccine. Both have about 95% efficacy to prevent COVID-19 disease and severe illness of COVID-19. So at this point, they've rolled out the Pfizer, they've received the emergency authorization, and Moderna was emergency authorized this past Friday. Right now, about 6.5 million doses are going out. Now they're in phases that will be vaccinated. So, hey, let's use the term when it's my turn. So, you know, my turn as a healthcare worker is here now. And so that as a healthcare worker, they're going to be essential persons as well as long-term nursing care or long-term facilities that will be rolled out first in the first phases for these limited supply of vaccinations.
Okay, so it's going to go healthcare workers right now, because I've seen some friends that I have on Facebook that work at different hospitals. They're getting the vaccine now, so they're first. Then it's going to be the long-term living facilities like nursing homes that are going to be round two?
Yes. So they have them divided like tiers and phases. So 1A includes the healthcare workers as well as the long-term care facilities. I believe some of the retail pharmacies are assisting in the long-term care facilities that are going to get those vaccinations distributed. But you're right, the hospitals mostly got the Pfizer vaccine when it rolled out immediately, the big hospital systems, because the difference in the two, we have to look at the handling and storage of both. The Pfizer is a little more complex than what Moderna is. So Moderna is the one that's going to get out there to the communities that that's the one that we anticipate to get in the next few days. I'm just so happy because we just received our first kit that came in today. So it's coming.
So the Pfizer vaccine is what the healthcare people are working right now. The Moderna one, you said, just got approved, I think, on Friday, and that's going to be rolled out here pretty quickly. What's the difference between the two?
So the Moderna actually, some of the hospitals did receive, I think about 23 hospitals did receive the Moderna yesterday. And the difference between the two, well, really, like I mentioned in the beginning, it's more of the handling and storage. Let's talk about the similarities, really. The similarities are that both are about 95% effective to prevent disease for COVID-19. Both are made through messenger RNA. What does that mean? That means that it doesn't affect your DNA. That's your genetic material. That's what most people are very skeptical about. So both are made through this technology, and this technology did come about a while ago. They've worked on it from other vaccinations that they were working on for Ebola and Zika. So it's not anything new. You hear the term warp speed, and people think that, oh God, it's, they just did this immediately. It's gone through all the same channels as any vaccine that would be recommended for use. So we can say that the FDA has looked closely at it. An external approval board for vaccinations has reviewed it before the emergency authorization was released. And then they recommended to the FDA to approve it for emergency authorization. With that, Gardy, now, this doesn't mean that it is mandatory, okay? This is our choice. That's why I say when it's your turn, I hope and encourage the community to get vaccinated because it is our choice. Why should we do it? Because it's more than just protecting yourself. It's going to protect those persons that are at home with you, your family members. It's going to protect the coworkers you work with. In fact, me as a healthcare worker, it's going to protect my patients. So, in that aspect, it's very important. And so both of those vaccines, are very similar in that case. Both have also the similarity, both will be 2 doses. Now, the difference is Pfizer is going to be 21 days apart. Moderna is going to be 28 days apart. Okay?
Yes.
But those are pretty much, we know they're going to be 2 vaccinations.
So with the 2 vaccinations, is one going to be more, I guess, intense than the other one? And is it possible to shed that virus from having, getting vaccinated? Could you potentially spread whatever, COVID to somebody else?
So that's a really good question. And why I say that is because I'm going to go back to what messenger RNA is. This basically is a technology that is not the virus. We are not going to introduce COVID-19 into our systems as a vaccine. It is not a live virus. It is like a little part of the gene of the COVID-19 or SARS virus that is going to elicit an immune response. That's what we need in our bodies to prevent us from getting infection. Now, you mentioned, can we spread it? Well, we shouldn't be able to spread it because it's not the actual virus. Will we get some symptoms? We shouldn't get any symptoms of COVID-19 like cough, or congestion, things like that. But with that first injection, there's possible we could get some side effects. Probably the most common one, about 70%, is reaction at the actual injection site, which is intramuscular, and it will be, right there in your deltoid muscle or your shoulder muscle.
So you just get some soreness right there, really?
Yeah, you probably will. I understand that the second vaccine may have a few more, and we do have to call them side effects, but they're not serious. You might have a little joint pain, some fatigue. That's another common one, meaning you might feel tired. Some of these symptoms may last up to 24, 36 hours or so. But, the interesting thing is, yes, you're going to have the chance to also, when you receive the vaccine, is to we can also be a part of science here, not in the fact that we're trying to prove the vaccine works, but if there are other side effects that happen. I'm sure a lot of us have seen the media and some of the side effects that have occurred. A lot of those side effects have happened in placebo groups. Some of the reactions, allergic reactions that have occurred, those could occur in incidents with any vaccine. But we're going to sign up when we get the vaccine for what we call V-Safe. V-Safe is a way to track us on our smartphone. Okay, not to say track where you're doing, where you're going every day, but to track how you're doing. So it's kind of like they'll contact you. I believe for the first 5 weeks, it may be weekly. It's pretty intense. Where they'll contact you, make sure you're doing okay, or you can go into the system and say, "Hey, I had a stuffy nose today," or "I
Mm-hmm.
had this." That way, we'll know more about what the side effects are. Remember, we are 6 months into following the first vaccine trials, into where we know exactly what those side effects could be.
Has there ever been anything else developed this quickly? I've read some, and it says that this is almost it's pretty extraordinary. 6 months that we're here at this point, and we have these vaccines.
When Dr. Let's say this, I am a not the scientist that helped develop the actual vaccine, but I am, very encouraged that with us, looking into the communities and getting the communities vaccinated, that there are going to be some vaccine hesitancy about this. And so I'm here as the Chief Medical Officer, Community Health Network, to help try and build confidence in that. That this vaccine is safe, it's efficacious. Yes, the word warp, warp speed. Yes, this vaccine was created at a intense speed, and it's going to go back to when Dr. Fauci. I followed him throughout. He said, he expected to see something within a year. Well, he's of the know as an infectious disease expert that knows what they had in store. They knew that they had this technology available already and that it had already been proven to be able to work. And so I just feel like, this is a gift, that this has happened this fast. I think it's, part of a bigger plan. I've done clinical research before. I know how things develop. I know how they go through clinical trials. I know, the confidence levels and the sensitivity, specificity. I know all of that. And the FDA and the approval that it's gone through, they have accelerated it, yes, but they haven't skipped any steps.
Mm-hmm. So, what if? So the way that the messenger RNA works, I'm not sure, but I know viruses. Like I think of the flu. There's a flu shot every year, and the flu kind of changes, and it, sometimes the flu shot's effective, sometimes it's not. How is that going to work with this vaccine with COVID? If COVID is shifting, or is it?
Oh goodness. You know what? Over the last few days, they have noted in the UK that there is a different or a mutated strain of the virus, and they're working hard not to have it come into the United States. It seems as if too it may be that it is a little it could spread faster, but the good news is it does not seem to be as it won't be as deadly or you know, I hate to say that because this has been a deadly virus in itself. Um, but the good thing with the messenger RNA is that, remember, I said this is a little part of the SARS or COVID-19 gene. So it still can elicit that immune response to protect us against COVID. So we still think it's going to work. But again, we're going to have to see long term. So you know, it's just like the influenza. We do take that, and I encourage everybody to get out there and take your influenza vaccine. That's very important to do. But with the influenza, we do take it annually.
Hmm.
And most likely, I wouldn't be surprised if we end up taking this vaccine annually as well. But don't hold me to that. It would be nice if this, you know, causes immunity for the rest, like some of our other, you know, say for instance, our Tdap that lasts 10 years or
Yeah.
some other things.
So right now we're talking to Dr. Yvette Poindexter with Community Health Network. This is KHEA Radio 99.5 FM. It's 10:34. If you have questions, feel free to ask. We have a couple more minutes with her, so get those questions in. You know, my question is, if you have had COVID-19 this year, whether that was in March or in December, is there a point in getting this new vaccine, and I guess why?
It is a point to get it. There are a few populations that they don't have good studies on. With COVID-19, you know, I have seen firsthand experience within our organization that some people are immune to the virus, still from, you know, earlier from their infection. However, I've also seen reinfection of persons with COVID-19. So we don't know how long the immunity lasts, you know, that persons that have had it. So what we do ask is, if you're planning on getting the vaccine, we would like that. If you've had COVID-19, it'll boost your immune system even more. But we don't want you to get it if you're suspected to have COVID-19 at this time. We would like for you to receive the vaccine after you're out of isolation or quarantine for COVID-19. We don't want you to receive that vaccine when you have symptoms of COVID-19 or you're suspicious of COVID-19. There won't be any routine testing for antibody or to determine whether or not you had COVID-19 or you have COVID-19. We're going to ask you those questions when you come to get your when you come in to get your vaccine.
Okay. When will this vaccine be available for people like myself and people listening on KHEA that don't work in the healthcare field or are not in a long-term living facility?
So, you know, there will be phases, tiers of whom will receive the vaccinations. The next are going to be those in the certain populations, such as those who are 65 and above. So those that have chronic disease such as hypertension or diabetes. So those are coming. Remember, we mentioned that these phases, as they're introducing them, they're limited vaccinations right now. Now, it's going to be important for us to determine what is, you know, it's our choice to get vaccinated. So if you need to talk to your provider, your physician, about whether or not you should be vaccinated, I think that's an important discussion to have with them now, so that you'll know when your turn comes to get the vaccine that you can go ahead and proceed with it. There will be some locations, you know, that will be distributing the vaccination. Like I mentioned, retail pharmacies we will be distributing the vaccination at one point to the persons when it is their turn. So that next phase will probably start, I would say, in the next couple of weeks, maybe within January. Because what you're seeing right now is, if you look on the CDC website, great resource of information. right now they just have some basic information about how many have been distributed vaccines, but I only see 600,000 people that have been vaccinated. Now, didn't I just mention earlier it was like 6.5 vaccine doses that are out there? So we have to think about that it's safe, it's efficacious, meaning it will prevent the disease, the illness, and get the people out to feel confident in it. Now, there is a lot of hesitancy, especially in the Black and Brown communities. So, right now, I'll say it's probably about 67% for everyone who wants to take the vaccine. For the numbers in the African American community, it's at 55%. So we really have to look at those disparities amongst persons, and get the confidence level. I'm waiting to get my vaccine. I am hoping, like I said, we'll get the shipment either today or tomorrow, so we can start distributing to our actual staff members. I'm going to go Facebook Live on it, and as a member of Community Health Network, like I said, we're a community organization, and we're going to focus on building that 75% up to confidence so that we can get vaccinated and we can restore some normalcy here in the United States. I just wish we could do it yesterday, just because, again, of the people who are losing their lives to COVID-19.
Okay, I have a couple more questions. We're talking to Dr. Poindexter with Community Health Network on KHEA Radio. Is there any reason for someone not to get it?
The reason not to get it, again, let's say this, let's, make sure that you confide in your physician, your provider that you work with. But there haven't been a lot of studies done in pregnant women. It's not contraindicated, meaning that you can still get the vaccine, but we need to make a shared decision on that. Whether or not you're out as a healthcare worker or you're an essential worker and you're exposed to COVID-19. So it's not a contraindication. The other studies that have not been done are on young children, adults. Those studies are upcoming. So one vaccine, which will have the Moderna vaccine, under 18, we will not be able to vaccinate with the Moderna vaccine. Under 16, I believe, with the Pfizer. I know with the Pfizer vaccine, if you're going to have the Pfizer vaccine. The most important thing is if you have severe allergies, we need to be notified of that because we need to monitor you after the vaccination. We will monitor you 15 minutes regardless, but if you have certain allergies and you get the vaccination, we need to monitor you about 30 minutes. Those persons who absolutely cannot get the vaccine are those who have had a severe anaphylactic reaction to the first dose. They will not be able to receive the second dose. There's still a lot of studies on the immunocompromised as well. If you're immunocompromised, that is a discussion or a shared decision that you need to make with your physician. So there are really not many things that hinder us from getting the vaccination.
Okay, so here's the final question that I have, and this was asked by a couple people who are watching on KHEA Radio's Facebook page. One person asked, how does it work with COVID-19? And then, how does it affect the virus or protect against it? And then someone asked about it bonding with the DNA. And you spoke about this a little bit earlier, but can you speak more on the messenger RNA, how it's a messenger RNA vaccine? Does it change your DNA? How does it work?
Okay, I surely will. So the messenger RNA, we have RNA and DNA on our genes. The DNA is pretty much the genetic material. The messenger RNA is from the COVID-19 virus. It does not does not integrate with your own RNA or DNA. What it does is that messenger RNA through the vaccination, through a liquid, is introduced intramuscularly in the shoulder so that it causes an immune response. We all know about fighting off colds, the common cold, how sometimes we have to go through a little bit and we fight it off. Our body can fight it off. So it builds up these antibodies in our system that actually fight this messenger RNA so it won't attack your body. During that time, yes, you may, like I said, you may have some types of symptoms, whereas fatigue or joint pain or low rash. But what does that mean? It just means that it's working. Your body is fighting against it. So it does not, again, go into your DNA, and it will not give you COVID-19. So again, there's a lot more to learn, but that we do know right now from the original trials.
Dr. Poindexter, thank you so much for joining. Is there anything else you'd like to share today?
I just would like to say, again, thank you for having me on. Again, here I have a community health network. We are here again for the community. We're in the certain communities in Brazoria County, in Galveston County, in Southeast Houston. We'll take care of you as a holistic approach. But one of the things we'd like to encourage is, do your own research. Go to CDC website, read about this. Come to us. Let us talk to you about the vaccination. And to be here in the community is awesome, because even though we've gone through this, we've gone through COVID-19 together, through the pandemic, we never stopped working. We also have done behavioral health. We do behavioral health. We do dental. We do medical care. So we're not going to stop there with just your COVID-19 needs. We're there for you as a community. And just thanks again. Again, I'm honored to be here this morning.
You're welcome back. Anytime.
Thank you. I've enjoyed.
Thank you so much. It's KHEA Radio, 99.5 FM.